I think as multidisciplinary team meetings have developed over the last, over 15 years now, it has become very clear that the purpose of the meeting has changed with time. When they started in the late 1990s, early 2000s, it was really mainly a device to make sure that all patients with cancer within a geographical region were being seen by a multidisciplinary team, and there weren't outlying doctors who were treating patients in isolation, perhaps with suboptimal treatment for the time, saying, I've treated cancer X for 20 years, I've got a perfectly functioning separate clinical team in the hospital, I don't need to go once a week and sit there with a whole load of other colleagues and go through every patient. And that was really the starting point of them, to try and get these outlying physicians and surgeons and bring them into a team so that we could make sure that all patients were treated within standards of care. Now, there are always going to be patients who are not treated exactly according to the standard of care for some very good reasons. Sometimes it's patient preference, sometimes it has to do with comorbidities, sometimes it has to do with technical reasons related to surgery. But those patients, by and large, will be a small percentage. And the multidisciplinary team meeting is a place that allows the discussion of such patients and also the collection of data to have a sense of, is a team really performing and proceeding with treatments that are standard of care? And it's also quite a good place to collect outcome data. The other important aspect of a multidisciplinary team meeting is that for difficult cases, for cases where there really are a number of options and the decision is quite difficult technically, that this is a forum where you can sit down with the pathologist and the radiologist and the surgeons and the oncologists and the nurses and sit down and say, well, what are the options here? It's also an opportunity for the team to meet, and we shouldn't underestimate the benefit of face-to-face meetings outside clinic where everyone's in a room together interacting, and that has a huge binding benefit on the team. It's also a place, therefore, where everyone knows where everybody is once a week, and you can have management meetings, academic meetings, teaching meetings bolted on. So there are one or two other benefits to multidisciplinary team meetings, not just patient discussion.